Hi friends, this is Dr. Abdequaem Chimthanawala. You must have seen a lot of remedies, for example, Yohibinum magnesca, selenium, Avena sativa, given for male sexual complaints. But let me tell you, there are a lot of other polycrest remedies having very important symptoms related to male sexuals, and what will happen if you try to prescribe this remedy, it works as a constitutional medicine also and give you better result and long lasting results. So the most important remedy that you should remember in this is sulphur. Of course, sulphur has been proved thoroughly and it has thousands and thousands of symptoms, but in relation to sexual fear, sulphur has very important symptom which I have seen in my practice, clinically verified symptom. And the first symptom that you should remember is the atrophy. The glands penis especially is shriveled. That is the first indication of sulphur what I have seen in my practice. As you go further in sulphur, remember the coition is painful. There are other remedies where the coition is painful, but sulphur is a very interesting remedy. Apart from this, you should remember sulphur, kalicarb, natrium uroplatina, where the coition is painful. Next symptom, as I told you about the glands, the prefuse. In sulphur, the penis, especially the prefuse, is cold, and the patient will come and tell you कि डॉक्टर साहब बहुत ठंडा ठंडा लगता है. He feels as if the prefuse is very cold, and because it is fitted in our mind that sulphur has a lot of burning, we fail to appreciate this symptom and miss out sulphur and give some other remedies like zincum or berberis or indigo. But if you look in the Mathematica, coldness, the prefuse, especially the prefuse of the penis is cold. The most important remedy that you should remember is sulphur. Again, the same thing, it goes to the scrotum. There is coldness in the scrotum. So whenever there is coldness, we normally don't think about sulphur, but sulphur is a very important remedy if the scrotum is also very cold. Of course, if the scrotum is cold, you must think about phosphoric acid or capsicum or caladium or berberis. But sulphur also is a very important remedy in this symptom. As you go further, in sulphur, I had a beautiful case where the patient used to tell us that the ejaculation was bloody or mixed with blood, with semen. In that is a very important symptom of sulphur, that a seminal discharge is bloody. Of course, the seminal is bloody is sulphur. If the seminal discharge is what you call burning, that is also sulphur. But if the seminal discharge is mixed with blood or bloody plain, you must think about sulphur. Of course, you must think about sulphur, mercury, causticum, I think mercor is there, and canther is also. The seminal discharge is bloody. So these are very important symptoms that I have found in my practice. And one symptom of sulphur is important, that seminal discharge is so premature. It is so quick, even before the act or even before the coition there is discharge. And with this symptom, I have cured a lot of cases with sulphur when the seminal discharge is so premature, so quick, that before the coition there is discharge. So don't always think about the sexual remedies like Agnes cast or Damiana or selenium, but this is a very important and a very three-marking symptom of sulphur. Sometimes what happens in sulphurcation, the erection is troublesome. It is wanting. There is impotency, and the patient feels that the penis is small again and cold. So see the coldness in symptom in sulphur regarding to male sexuals. It is sulphur. So when the erection is troublesome, impotency is there, the penis appears small and cold, think about sulphur. Think about brattacarp, think about lycopodium. Of course, Agnes cast is also there, but sulphur as being the polycrest remedy, if you prescribe this, the result is long lasting and it is a constitutional remedy. So you may cure a lot of complaints with this symptom. Then again, a very important symptom and related to sulphur, as I told you something about the prefuse, the glands. Again, when the patient comes and tells you the prefuse appears very hard, the prefuse says, "See kitna kadak lag raha hai," that is a very and a three-marking symptom of sulphur, which I have seen in so many of cases where it is written that male in organs, the prefuse is hard, and this hardness symptom of sulphur is very important in your practice, and the patient will come and tell you. As you go further, the patient can also complain about induration of the glans penis, and we have only 2 remedies for this. Very, very important. I have most of the time used sulphur, but the remedies cannabis sativa can also be thought of. So in related to glands, penis, to profuse, this sulphur has a very, very important symptom. You know, you can also have a symptom where the induration is in the profuse. That is also sulphur. Sulphur is there, lac acid is there, mercury is there, but again sulphur becomes a very, very important symptom in these conditions. There are many of symptoms of sulphur. I am just telling you the symptom which I have seen in my practice. One symptom that everybody should remember. See, whenever an old patient comes to you with a lot of sexual desire, we normally think about lycopodium, but my friends, think about sulphur. Like when the sexual desire is increased, especially in the morning in old persons, we think about lycopodium, we think about fluoric acid, but sulphur is also important. In fact, it is written that a very important symptom that in old man, if the sexual desire is increased, do think about sulphur. Again, fluoric acid, lycopodium are there, but sulphur is a very important remedy in these conditions. So these are very, very important and the 3 marking symptoms which I have seen clinically in my practice and verified in my practice. So whenever you're basically treating main sexual organs, don't always think about the so-called remedy which has a lot of sexual sphere in it. Think about some polychrist and think about sulphur. So my dear friends, if you like this video, do share and subscribe. Thank you.